Hello, my name is Julie Tyrer. I'm Tissue Viability Nurse Consultant, and this is Sammy Mills, Tissue Viability Specialist Nurse. We've been using Dolphin mattresses here for about 4 years. I still remember the first patient who we conducted an evaluation of the mattress with. I remember her for many reasons. She was a young woman. She'd had an aortic dissection, so she was on the theatre table for about 36 hours. When she came off the theatre table, she went straight onto the Dolphin mattress, and she was still very unstable and could be repositioned for many hours afterwards. When her skin was first inspected, there was some tissue damage, but there was a lot less than I expected there to be. Previous patients who'd been in the same situation on the theatre table for the same length of time, we'd seen deep tissue damage that progressed to unstageable pressure ulcers. So a pleasant surprise, and as a result of that one evaluation, we decided to incorporate the Dolphin mattress into our mattress selection criteria.
My background is a tissue viability nurse for 2 years, but previous to that I was an intensive care nurse. So I saw a massive change when the Dolphin came into effect. We saw a reduction in pressure ulcers, patient skin was a lot better. Tissue damage obviously reduced as well, and it is quite an easy product to use as well, so the transition was easy.
So we worked with our theatre staff and our critical care staff in particular in developing our own patient selection criteria. The length of time the patient's on the theatre table, whether or not they have multiple bony prominences, their cardiovascular status, and to predict that the patient's repositioning is going to be limited post-op. That patient selection criteria is utilised very well with our theatre staff in particular, and we have assurance that our riskiest patients are transferred directly from the theatre table at the earliest opportunity. And as a result of that, we see benefits for our patients.
As a sister on intensive care, when we first started using the Dolphins, it was always a relief to find that when a patient hadn't been able to be rolled for 3 days, that we were doing a Dolphin mattress, so it wasn't as scary when you rolled them. You knew you weren't going to get a really scary surprise when you did that, so that's why I used them.
We were able to demonstrate quite easily a cost benefit of incorporating Dolphin mattress into our mattress selection. We use the Department of Health Productivity calculator, and by entering your pressure ulcer incidence by category, it will calculate the financial cost of those pressure ulcers to an organisation. This was in no way comparable to the expense that our hire of Dolphin mattresses was going to incorporate. We'd have no hesitation in recommending the Dolphin mattress to move forward, do an evaluation, just to see if they can improve outcomes for you, as they have done